Hello, how are you?
Doing well. How are you?
Doing well.
I do have a question. I submitted my project, I think in the wrong area. I submitted where we're supposed to do our peer reviews. Did you see that?
I did not. If you submitted it today,
No, on Wednesday night. But then I thought that's what I was supposed to do, and I didn't put it in the where the chat goes. But I did it Thursday morning, like at 5 o'clock in the morning.
okay.
But
And
I think I need to just correct. Do what you told us to do for the submission for the group project.
so you can't unsubmit it and then resubmit it from your end.
I can resubmit it. I'm just letting you know what I did wrong. If I didn't know if you saw it already.
Okay. No, I haven't. And thank you for letting me know that. And just go ahead and correct it. And
Okay.
I'm making note that you've informed me of it. Yes. And
Okay.
it won't count against you as being late or anything. Thank you for letting me know.
Thank you.
You're welcome.
And then was our homework added to our grade?
I think she turned it on. I think they actually turned it on. They turned on once you got past the last exam. They turned on the other activities, the other assignments. I know some people said their grade didn't look like it moved.
Yeah, it didn't change. Yeah, mine didn't change.
Yeah.
Okay. All right, just making sure. Thank you.
Yes, ma'am. You're welcome. They were supposed to turn on that's someone else that actually has that keystroke, and they were supposed
Mm-hmm.
to turn it on once we made it past that second exam.
Okay.
Yes, but I can check on it to see because I know you're not the first person that said they didn't look like their grade didn't change any.
Okay. Thank you.
You're welcome. You can go ahead and just put your name in the chat box. You'll have that out of the way. Your name and your
All right.
campus.
Okay.
Mhm. Hello, how are you? Good evening. Hello, how are you? You all can go ahead and start placing your name and your campuses in the chat. Get that out of the way. Good evening to everyone. Go ahead and place your name and your campus in the chat. We have 2 minutes and we will get started. Hope everybody's doing okay today. We have about 1 minute left. 1 minute. Go ahead and place your name and your campus in the chat. Good evening. Good evening. Hopefully everyone is doing well. It is 7 o'clock and we will go ahead and get started. So we will, I'll do some discussion of some important points. We'll start with chapter 11. Then I have a Quizlet. I'm familiar with I used Quizlet before? Is anyone familiar with Quizlet? Yes, okay, I see some heads nodding. Okay, so we'll try that out. And I do have some videos I think that are pretty good that kind of speaks about the different disease processes that we see in chapter 11. So again, good evening to everyone. Go ahead and turn your cameras on, place your name and your campus in the chat. We will go ahead and get started. So I'm going to discuss some important points from chapter 11, then we'll move on and look at the videos, and then we'll go back to our Quizlet. And I think I'm able to share the links for the Quizlet if you want to go back and view those and at a later time. Because with the Quizlet, you can use flashcards, you can do, depending on your learning style, there are different type games and resources within the Quizlet that you can actually do. Okay, so infectious diseases and prevention and control. So we're still talking about the agent, the host, and the environment. So we will just make sure you have a good understanding of what each of those are. You have to be able to apply them to the scenario that is going to be. The successful interaction between the infectious agent, usually that bacteria, that fungi, is the thing that infects the thing that affects the thing. The host is usually like the person, could be the animal, and the environment. Of course, we know that's where it is. In all three of those, that triangle is necessary for disease transmission to take place. Effective interventions and measures at the individual and community levels must be aimed at breaking that chain, that link between those three agents, between those three links, the agent, the host, and the environment. Healthcare professionals must constantly be aware of the vulnerability to threats posed by emerging infectious diseases. We'll look at some of those as we go through the chapter. And it just seems like almost every other week or so, there's an emerging disease on the rise. I saw something the other day, and I don't know if it was real news or not. I just kind of skimmed it, and it said something about tomato flu. Not sure what that was, but I didn't, go in detail to see what it was actually talking about. Infectious diseases are preventable. Preventing infection through primary prevention, that's usually the most cost-effective public health strategy, is that prevention, provided that education about preventing those diseases. Communicable diseases prevention should include drug treatment, the vaccines, and of course, health promotion. And we play an important role in all of those interventions. You will interact with other healthcare professionals trying to coordinate those resources. Communicable diseases were the leading cause of death in the United States. The transmission of communicable diseases, again, depends on that agent, the host, and the environment. Be sure to look at box 11 at those 6 characteristics of an infectious agent. You know, you have your toxicity, your invasiveness, you know, the ability to enter and multiply in the host, the infectivity. So be sure to look
Professor
at,
Martin,
yes.
are we supposed to be seeing something on our screen besides everybody else?
No, I'm just right now, I'm just giving an overview of chapter 11. When we get to the video, yes, when we get to the videos, I'll show them to you in the Quizlet.
Okay, all right, thank you.
Thank you. It's just an overview of some of the main points. Remember, it talks about the immunity, the herd immunity. So what is you all's understanding of herd immunity? That's been in the news like over for sure. They first started giving out the COVID vaccines at the end of 2020, December of 20. No,
it was December 20. Yes.
December 20, yes, because it's that, yes. Yes. So for sure by February, herd immunity was all over the news. And so what is your understanding of what that is, and what were they telling us to do in order for that to take place?
So I think it's from when some of the population gets COVID and gets over COVID, and then some of the population gets the vaccine and gets our immunity from that. And herd immunity comes when both people have the immunity towards the virus from getting it, or they have the immunity towards virus from having the vaccine.
Okay, do we agree with Ms. Barbara, or we disagree? Either way, agree or disagree, and then give me your explanation. Let's hear from 2 more. Herd immunity. For sure by February of 21, if you hadn't heard of what herd immunity was, it was all over the news.
So I know where I worked, a lot of the nurse practitioners and doctors did not want to get the vaccine because they wanted to depend on herd immunity. And it's basically it's an environment. It's kind of like you get your own immunity by being exposed to it in a way. By running with the herd is how they explained it to me.
Great. One more person, let's hear from you. Herd immunity, what's your understanding? What did you hear about it? What do you know about it?
It's basically when the community has reached an amount of people that are immune to the disease. And also that way, basically the disease doesn't continue. It's supposed to disappear in a way.
Disappear, control, less occurrence. Great, thank you all for sharing. So, you know, when we look at the environment refers to, it could be physical, biologic, social, or cultural factors. So an example of reduction of communicable diseases by altering environmental factors is using those mosquito nets, putting those repellents on us when we're going out in the yard, and you know, washing utensils, not using the same utensils for raw meats as you would, you know, cooked meats. Modes of transmission, we have that vertical and that horizontal. And we're gonna capture all this again in the quiz that we're going to do. So I'm just hitting over the high points, you all. Vertical transmission occurs when the infection is passed from the parent to the offspring. Then horizontal is from person to person, you know, through one or more of those routes, you know, the direct, indirect, airborne, or vector-borne. the incubation period and the communicable period, they're not the same thing, but I think sometimes when we talk about it, I think we kind of use them like they are, but the incubation period is a time interval between invasion by the infectious agent and then when those signs and symptoms first appear. The communicable period is the interval during which the infectious agent may be transferred directly or indirectly to another person. So was it back in 2001 when they started talking about bioterrorism and those that agent was the anthrax, the powdery substance, you know, we were afraid, or they were telling us be cautious when you would go get your mail. And I want to say, no mistake, several people actually were sickened or passed away from being infected with that agent anthrax. And it was pretty much to be found in a lab, from my understanding. So not really sure how people got their hands on it and was able to send it through the mail. So we talk about anthrax. We're gonna talk about smallpox. It's been pretty much eradicated. Now, when I first heard about the monkeypox, they were saying, you know, you have chatter about things, but I don't know this to be factual, but they were saying, well, hey, if you have received your smallpox vaccine, then you should be good. You won't get the monkeypox. I haven't heard anything else about that. But for the most part, smallpox had been eradicated since the 70s. But that could be an agent too that they would use as a viral terrorism agent. Anthrax, smallpox, and it was one more. Can't think of it right now, but those are the two I think that your chapter speaks of. Again, vaccines are one of the most effective methods of preventing and controlling communicable diseases. So how do you, what's your thoughts about vaccines? You know, we're not anti-vaxxers, we're not pro-vax, against vax. What is your understanding, or, you know, what's your thoughts about vaccination? Get vaccinated or not? Let me hear from you.
I think people should get vaccinated.
And then can you give me a why? What's your evidence or your support?
Well, we've been able to eradicate and stop the spread of a lot of diseases like chickenpox. That was a huge thing. With me growing up, I had the chickenpox. We used to have chickenpox parties. Now they have a vaccine for it. You don't really see it that much. Polio. There's like an outbreak in New York, and this all really started with unvaccinated individuals. I just think a lot of children can be saved, a lot of immunocompromised individuals, and I just overall have a positive viewing of them.
Okay, thank you for sharing. And remember that keep in mind the greater good for the most. We know that there are gray areas and, you know, it's not 100%, but keep in mind the greater good for the most. And I had the chickenpox too, and that was something. And it seems like it was highly contagious. It seems like it went through the entire school. But now you rarely hear children catching, you know, saying that they have a chickenpox. It's just a rarity. It hasn't been eradicated, but it's a rarity. I didn't know that was in the news about the polio. Thank you for bringing that up. Someone else, just share.
I am definitely pro-vaccine. I went to school with a boy that had polio. He wore leg braces. He had a very hard time getting around. And I don't know what happened to him as he got older because I moved away from the city I was in. But I mean, I know it must have, you know, cut years off of his lifetime expectancy. He had a lot of medical issues. And I just feel like if he had been vaccinated, like a lot of kids were, he wouldn't have had to have those problems. And plus the kids that can't get vaccinated because they have immune problems, they depend on our vaccines for us to be vaccinated, so they don't have to worry about catching, you know, polio or measles or anything like that.
Thank you for sharing. Great point. Let me hear from one more other individual.
like Barbara said, like, it keeps people from having like that's immunocompromised from they can depend on the herd immunity happening and they be in a better safe environment from catching another disease. Wherein if you don't get vaccinated, you as we see with COVID, these viruses mutate. So the people that aren't vaccinated is getting the mutated version, and then the immunocompromised is dying from the mutated version. But the rest of the people that did get vaccinated potentially gave them herd immunity from the normal COVID, strand. But as it mutates, it, becomes more dangerous. So I'm also pro-vax.
Thank you for sharing. Yes, all good points, good points. You're right. And so, and people are saying, well, hey, you got vaccinated and now you're getting it, but it's a different strand. And so speak to if someone says, hey, I got the flu shot, but I still ended up with the flu. What you ask that community health nurse, what would your response be to them?
You ain't die. But that ain't gonna be my real response. But that's but like that's literally what I'm thinking. Like, because a lot of people think that it's the flu vaccine, oh, it gives me the flu. That's what everybody was saying. No, it lessens the symptoms from you dying from the flu that kills people every year. Let's be very clear. But a lot of people don't understand that, so they don't get it. And don't get me wrong, I'm also a little weary about the flu because it mutates so much. That vaccine is only like maybe 10%. One of my allergists told me a couple of years ago, it was like 10% accurate because the strands change so often, but people didn't know that it's because you're not getting vaccinated.
Great, and that is the point that I was hoping you all would bring out. It is there are so many strands. I'll be quiet. Go ahead, Bob.
I just want to make a point. I give the COVID vaccine every day, and people come in and sit right down and say, I want the vaccine so I don't get COVID. I'm like, hold on. You're getting the vaccine so you don't die from COVID. You can still get COVID, but you won't die from it. There's a difference. I keep telling them, you can still get it, but your symptoms will be less. You may not get symptoms, but this will keep you from dying from it. So I just always have to remind people that you can still get it when you get the vaccine. So yeah.
Thank you for sharing. The flu shot. I got the flu shot, but I still ended up with the flu. You're doing a health fair. What education would you provide? Primary intervention would you provide for that person? What explanation would you tell them? Remember, the flu virus is a viral respiratory infection. It's transmitted through airborne. It is airborne and through direct contact through those infected droplets. So you're coming through, take that breath in, and that infected droplet is that droplet that you inhale. There you go. There are 4
Wash your hands.
Wash your hands. Good. What else would you teach them? What else would be part of your educational plan for that day? Your important
Wearing
point.
a mask.
Wearing masks. So just think about it. Good point. Do you think? I know we started wearing masks when COVID, came about, was more prevalent. But do you think if we were wearing masks years ago when it started to be flu season, on into when flu season, the height was really heightened, do you think as many people would have gotten the flu? I see heads going left to right. So I think
Probably not, because they noticed the number of flu cases decreased when the pandemic started because of all the mask wearing.
Exactly. And I just can know myself, I was like, I didn't get like the sniffles. But I don't know if you all, during flu season, the wintertime, you get the sniffles. I didn't get that. And I was like, oh, wow. We probably should have been wearing masks anyways. Maybe not as much, but at least during those times.
So what I was wondering, because just like, so my group, we did the research on the HIV or whatever. So I didn't even know if you have other STDs, you can get, it makes you more prone to get HIV, right? So I was thinking, does that happen the same way with viruses? Because rhinoenterol is the common cold. So there are sniffles, that's rhinoenterol, but you just didn't know you got rhinoenterol because you ain't gonna get tested. But does that make us more susceptible to get flu? or COVID or whatever.
Yes, and why? What is that?
Immunity is down.
Yeah, exactly. Your immunity is decreased. Your immune system is trying to fight. It's, we're fearfully and wonderfully made. It tries to, beat up, kick off, fight against that. But if you have those disease processes on board, everything is out there doing its job. And then sometimes, your defenses fall. And so you're open for other disease process to, to come on in and take over. Yes. Yeah. So be sure to look at box 11.3. It, just talks about 5 keys to safer food. And it's just talking about cooking your food thoroughly, making sure you separate your raw foods from your cooked foods. Those utensils, as I mentioned before, don't use the same utensils. And I think we're gonna go trend on over to our videos. I was just gonna talk a little bit and then let you look at some videos on the disease processes, and then we're gonna do the Quizlet and look at a case study. I'm getting ready to share the screen here. And I just picked a few of the disease processes in the chapter, and they're all short videos. And I can send you the links too if you want to look at them later on. It's the first one. And so we do know here, I want to say this week, maybe even today. I forget what state it is actually in. They're actually dropping rabies vaccines, in massive amounts because they're seeing an increase, I think, in skunks, raccoons, I forget the animal. But someone keeps up with all of this stuff. And so whatever state is in, they are dropping from the air all these rabies vaccines. And what they're hoping that animals do is actually, try to eat it. And so the vaccine will become activated and the animal will be vaccinated against the rabies. I forget which state it is actually in. But I know it's not, let me see, hold on, let me stop sharing, let me look real quick, because I thought that was interesting. I said, well, who would have thought rabies would really be in the news in 2022, but it actually is. Let me look real quick for you. Yeah. Anybody else hear about that? Them dropping the vaccines out in the state? Let's see.
I did.
It's actually in 13 states is what it's saying. Let me just share the screen. And there's not a video on it. Millions.
I know here in Florida, there were like, I believe it was like a few months ago, they were trying to catch all of like the raccoons because of that, because there was an increase on rabies in like 2 counties.
Yes, thank you for that. They're actually scattering rabies vaccines, from the air. They're in 13 states. And like I said, the hope is that the animals, particularly the raccoons, would eat it and is activated that way. All right, let's see. Let's look at our next video. That one.
There was a real palpable sense of fear the moment we got off the plane.
Uh-oh, I think it stopped it.
The Ebola outbreak of 2014 was the largest Ebola outbreak in history.
People had not seen a hemorrhagic fever outbreak of that magnitude.
There was transmission happening in healthcare facilities. And because of that, people had lost faith in their health system. They were afraid to go to the doctor.
Schools were closing, borders were closing, tens of thousands of cases, and thousands of people died. This was a humanitarian crisis in every conceivable way.
For CDC, the top priorities were controlling the outbreak in West Africa,
And really to restore public confidence in the health system and restore essential public health services.
Public health emergencies require a holistic approach. You need to know the who, the what, the when, the why, the where of an event. That helps you decide how to deal with it.
During a response, CDC subject matter experts come together and form specialized teams.
We had folks that were working on data, folks that were working on laboratory.
People with specialties in infection control, medical care, personal protective equipment.
Policy and communication.
CDC staff were located in every corner of the country.
And you develop relationships. You develop relationships with the people you work with, the Liberians, government, the hospitals. And many of them had people close to them who were infected or died from Ebola. It becomes much more personal.
During a public health response, and in particular Ebola, CDC leverages the Emergency Operations Center. It's our hub. It's our command and control organization.
Its mission is to support all the agency and carry out that.
They have expertise in incident command planning, situational awareness, and that particular set of capabilities really helps support the overall response.
At the end of the day, it's that integrated approach to dealing with public health. And that's what we bring to bear during an emergency.
Nowhere in the world, no agency in the world has that breadth of expertise.
CDC won't stop. CDC will keep.
So I think that was back in, was about 2011 when they were talking about the Ebola, but they immediately, of course, the WHO, World Health Organization, got the information out. And so, countries, we started preparing. And I don't think we saw many cases in the United States, if my memory serves me correctly. This one is about pinworms.
For Wisconsin is not real pleasant. Pinworms are intestinal parasites, and if your children have not gotten them, consider yourself lucky. The CDC estimates half of all children may have an infection at some point in life. Dr. Kristen Bensick is from Bayshore Pediatrics here to help us through this one. All right, Doc, well, let's get through this together. Tell us what are pinworms and how do parents know if the kids have them?
These are little parasitic worms. They look like
They're
little,
literally like little worms.
little tiny worms. Look like little white. This is a dental floss, and the way you'll see them is on your child's bottom. And what they are is they're little worms that you ingest the egg. They go into your intestine. They grow up in there. Takes about 2 to 4 weeks, and then they go out to the anus and they lay their eggs at night.
And then you'll notice what? Kids scratching? Is it real itchy or what is happening?
Bottom. They're super itchy. The anus will look a little red and irritated. You just see kids touching down there a lot.
I know this is something we talked about, whether it's lice or some of these other things. Parents have a tendency to be so embarrassed it almost prevents them from taking action. You were saying before, like this just happens, right?
This is so common in kids. Kids are not very clean.
They're not.
Their hygiene. And part of it is they're scratched. They don't wash their hands, touch things. The eggs actually live on surfaces and they can go airborne. So if one child gets it, you can pretty much guess the whole family's going to get it. You can pick them up anywhere. So it's nothing to do with being dirty or anything like that.
What is the course of treatment then? Is this something that parents can take care of at home? Do they need to see a doctor?
So a lot of times we do ask parents to bring their kids in because there are other things that cause anal itching too. You get strep infections, you can just get contact irritation down there. So it's a good thing to bring your kids in and let you actually see the little worms.
So first, you just want to make sure that's what it is, right? It's not something else. Okay.
Yes, the treatment is really effective. It's almost 100% effective. The one-time dose of a pill, you're going to repeat it in 2 weeks because the pill kills the live worms, but it doesn't kill the eggs. So you want to make sure you get both courses. And then after you treat, you want to wash all the bedding, wash the surfaces down, make sure everything's nice and clean.
And is this something that you're seeing? Is it seasonal at all? Does it have high
There's
times, low
no
times?
season with this. We see it all the time. It's just so common in kids, and parents are so embarrassed about it and completely freaked out by it.
Well, I would count myself among them now. Doctor, thank you nonetheless. Important information. And for more on pinworms or
Any comments about the pinworms? Anyone want to share any information? Okay, let's move on to our next video here.
There's some things that we advise to keep yourself and your family. There's some things that we advise to keep yourself and your family safe from cryptosporidium infections. The most common thing is to not go swimming if you have diarrhea. This is the way that we spread this infection. And so if you're having diarrhea, you have a risk of transmitting the infection to other people who go into the same swimming pool. So we recommend that people with diarrhea avoid going to public swimming pools. Avoiding activities where you might accidentally swallow some of the water in the swimming pool would be one of the best ways to prevent getting infected. The important thing also to know about how this infection is transmitted or spread from person to person is that you can actually pass the cryptosporidium parasite in your stool even once your diarrhea has gone away. So we have detected it in stool up to 2 weeks after diarrhea has gotten better. The kind of troublesome thing about cryptosporidium parasite is that it is surrounded with kind of a protective capsule. This makes it pretty resistant to the usual levels of chlorination that we use in swimming pools. There are special procedures that pools have to do called hyperchlorination if they are found to have this infection spreading through their pool, but it can be a difficult organism to get rid of.
Any comments on that video? Any personal experiences, anything you want to share?
You just made me not want to go swimming.
I know when she mentioned getting the water in your mouth. Yes, I know. It's like things that we do that it was just amazing that we're still as well as we are, because things you just don't think about. Yes. Uh-oh.
On any given day, about 1 in 25 hospital patients have an infection caused
What's going on with this one?
by their medical care. Almost half of these patients are 65 or older. There are 5 places where patients are most likely to get infections: in the bloodstream, the urinary tract, the gut, and the 2 most common places are the site of surgery.
Okay, so that one's not doing good.
And the lungs.
But it's talking about
The germs most likely to cause healthcare associated infections include C. difficile or deadly diarrhea, staph, including the drug-resistant type known as MRSA, a family of germs known as Enterobacteriaceae that includes CRE, the nightmare bacteria, Enterococcus, which can be resistant to an important antibiotic, vancomycin, and Pseudomonas, which can cause infections of the lungs and bloodstream. 1 in every 9 patients who gets an infection will die during their hospitalization. Over the last several years, great progress has been made in preventing some infections. For example, bloodstream infections in patients with central lines have been nearly cut in half in the last 5 years. But more work needs to be done. CDC's goal is to eliminate all healthcare associated infections. We work 24/7 to say.
So hospital or healthcare acquired infections. Not that the person went to the hospital with the infection, but while the patient was there for something else, they ended up infected. It's just like, wow. And so they've made several different, they've instituted several different practices. For example, they've added infection control nurses, and these people go around and they have several different tasks. But an example would be they go around and they ask the patients, hey, did you see your nurse wash their hands before they provided care for you? They ask them to fill out these surveys, and they do like the mystery observance. They observe, people, providing care throughout the day and things like that. They begin to bring the education to the nurses, rather the nurses always having to go to the education department to do the different educational components, the re-education. So what there's, I know in an area that I was in, they started bringing the education to the nurses. So whatever floor you were on, the ICU, the emergency room, they brought it to you. And so that made people, I guess, more, apt to get into what they were actually supposed to be doing anyways. But as a result of it, you know, the rate of infections went down because they asked people, the patients, hey, did you see your nurse? Did they wash their hands? And the patients would say yes or no, you know. And so as a result of that, then, you know, you got reprimanded or whatever. But a person shouldn't go in the hospital, you know, shouldn't come out and they went in for a routine procedure and they actually end up infected because, you know, it's something that, you know, we didn't do. But it happens. Let's see. This one right here is on the Rocky Mountain fever. And this one's a little bit longer, but it's pretty informative. This one right here, Laura.
Hello, my name is Dr. Paige Armstrong, medical epidemiologist with the Rickettsiosis branch of CDC. I am also an emergency medicine physician. Today, I'm going to discuss RMSF and provide information to help frontline healthcare providers recognize and treat this rapidly progressing fatal disease. Rocky Mountain Spotted Fever, or RMSF, is the most severe rickettsiosis in the United States.
Decrease.
With mortality rates as high as 25% in untreated cases. RMSF poses a diagnostic challenge for providers because early symptoms are often similar to other febrile illnesses, and yet decision to treat is based on clinical diagnosis. The sudden onset of fever and headache at the beginning of illness prompts most people to visit a healthcare provider in the first few days of symptoms. Since most deaths occur within the first 8 days of illness, clinical consideration and early treatment during these initial encounters are critical to prevent severe disease and death. The most important thing frontline providers can do is to keep RMSF the differential, because if you're not thinking about it, you will miss it. Here are the key clinical messages every provider should know about RMSF. It's a rapidly progressing tick-borne disease with non-specific clinical findings during early illness. Doxycycline is the drug of choice for treating people of all ages. Treatment is most effective at preventing death and severe disease when started within the first 5 days of symptoms. And never wait for the rash to begin treatment.
Let's see, I think I had 2 more, smallpox and pertussis. And then we're gonna move on to our Quizlet.
An ancient deadly disease that has existed for 3,000 years. An estimated 300 million people died from smallpox in the 20th century alone. It was fatal in up to a third of people infected. Early symptoms include high fever and fatigue. This takes between 7 and 17 days after exposure. At this point, the disease becomes contagious. The virus then produces a distinctive rash, particularly on the face, arms, and legs. The most infectious period is during the first week of illness. The resulting spots become filled with clear fluid and later pus and then form a crust, which eventually dries up and falls off. The person remains contagious right up until the last scab is removed. The virus spreads through person-to-person contact and saliva droplets in an infected person's breath. In 1796, Edward Jenner famously experimented with the origins of what would become a vaccine, but it wasn't until 1959 that a global eradication effort began. The last naturally occurring case of smallpox was diagnosed on 26th October 1977. It was officially declared eradicated in 1979. Some governments believe there is a risk that the virus that causes smallpox still exists in places other than laboratories and could be deliberately released to cause harm.
So that's one of those ones when they talk about bioterrorism, they speak about. Pertussis, do we know anyone familiar with pertussis, the whooping cough?
Yes.
Thank you. Oh, that feels so good.
Laura Stevens will soon be a first-time parent, so she watches her friend and mother of four to see how it's done.
Please don't grab the cup from him anymore, though. That sounds like gibberish.
Laura also relies on her friend for advice.
Supposed to be getting the vaccine for the whooping cough. Oh, yeah, the whooping cough vaccine. I just got mine on my appointment was last Wednesday. So have you done it with all your kids?
Health experts recommend pregnant women get a whooping cough vaccine, also called Tdap, during each pregnancy to give babies important protection in the first few months of life before they're old enough to get their own vaccines.
Perfect. Babies move around okay?
Why is early protection important? Most babies who get whooping cough during those early months struggle to breathe and get very sick. For some, it can be fatal.
So how does my getting the whooping cough vaccine protect my baby?
What happens is when you get the vaccine now in the third trimester, your body forms a protection. And in the third trimester, that whooping cough vaccine actually delivers that protection to the baby right from birth.
Is it safe then for me and the baby?
Absolutely. In research, there's been no evidence of preterm labor, no evidence of low birth weight. In my experience, I haven't seen any issues or problems with it.
Unfortunately, whooping cough cases are on the rise. We now see between 10,000 and 50,000 cases each year in the United States, and whooping cough is highly contagious.
Because the disease is often mild for adults and older siblings, caregivers may not know they are infected and mistake it for a cold or other minor illness and pass it along to the baby.
It's recommended that women get vaccinated during the third trimester of each pregnancy. And this is because the vaccine's protection decreases over time. So let me show you the nursery.
Okay. All right, so let's get ready to do our Quizlet. Let's see here. I'm going to share the link. No, I think I'll give you the code. Let me see. Let me go back up here to it. Go and let's see. Classic Live. Individuals. Here. I'm going to share my screen. So you go to Quizlet.live and you enter this code. Go to www.quizlet.live and you enter this code. And you put in your name. And I could give you the link too, I think. Maybe put it in the chat.
And do what again? I'm sorry.
So I put the link in the chat, but if you want to, just go to Quizlet.live and enter that code.
Are we gonna stay on Zoom with you?
Mhm.
Okay.
Yes. Once I hit create game, yes. I didn't put you on teams. Everybody's playing by themselves. Yeah, because if you were on teams, you would have to be by next to whoever you were playing with. So you just go to Quizlet.live and you just, the screen will
What
pop
is
up,
this,
you
like
just
a
enter this
Zoom?
code.
Okay, so what do we do now?
Okay, we ready? And start the
What's
game.
the code? What's the code?
So you should see on your screen a question
What's
and
the
some
code?
answers. The code is right here.
Right where I don't see it.
If you answer wrong, it takes you back to 0. So be careful. But the answer is on your screen. Let me move us down. You all have to tell us who you are at the end. Be careful. If you answer one incorrectly, it takes you back. And all of this comes from chapter 11. Get back in the game. Get back in the game. You can catch back up. There you go. Get back in the game. All right. Now, who was a giraffe? Oh, Lisa?
Yeah.
All right. Let's see here. Let me stop sharing so I can see who the other. Who was the dolphin? It didn't tell me your name.
I was Ryan.
Ryan, congratulations. And the tiger?
Jada.
Jada, okay, congratulations. You all are the top 3. And so, wait a minute, hold on. Let me stop. So all of that information came from chapter 11. The link is there, and I can share the link again in the course room. Uh-oh, I think I went too far. And the thing about with Quizlet, depending on your learning style, there are several different ways that you can play with the content, that you can actually look at the content. Like you can do flashcards. Let me go ahead and I'll share my screen and show you what I'm talking. I think several of you all said that you all were familiar with it. Let me just share my screen here. Okay, here we go. Let me share it. So all of these are different ways that you can actually look at it. Like I said, just depending on your learning style. If you want to test yourself, do flashcards, you want to match, so with that link, you can go in and just test yourself with the content. One more round and we want to move on. We want to move on to our case. Let's move on to our case study. Our time just goes by so fast. Let me stop sharing here. Let's look at our case study. Like I said, I can put that link. Well, I put it in the chat box, so you can use it anytime. Let's see here. Pull up our case study. Correct time. All right, and so we'll start off with which level of prevention immediately treat any foodborne infection, educate about safe food handling practices in the home, or immediately evaluate the possible source of any foodborne outbreak. So who wants to say which is which? Primary, secondary, tertiary.
Education about safe food handling practices in the home is primary.
Okay, do we agree? Okay, I see heads going up and down, so yes.
Yes.
Okay. Two more.
Did you want me to do all of them or somebody else need to go?
Professor, can you repeat it there? I'm sorry, I couldn't hear you.
Sure, either or, you can go ahead and, so we're just trying to see which level of prevention are you all saying each one? We said this one was primary. So what about immediately treat any foodborne infection?
That would be third one, like the first one would be third one and the last one would be second one.
So
The immediately treat foodborne intervention, the foodborne infection would be tertiary.
Yeah, tertiary prevention, and then the last one will be secondary.
Yeah. Yes.
do we agree?
Yes.
So this one wouldn't be tertiary? Why would this one be? What'd you say this one was? Just immediately evaluate the possible source?
No, that one would be secondary.
Okay, why would you say it's secondary?
Because you evaluate. So it's kind of like screening the person.
Oh, no, that would be tertiary too. That would be tertiary too. Because there's a foodborne outbreak. And they're looking for the source.
It already happened. So
Yeah, it's already happened.
So what about this one then? This one's kind of tricky to me. The
Immediately treat any foodborne out infection. So you're treating, you're treating any foodborne infection.
I think it's secondary.
Why are we saying
Tertiary.
secondary?
Secondary.
I say secondary.
Yeah,
Tell me
because
why.
it's not already, it hasn't already happened. They're saying
It's
treat
acute.
it. Yeah. They're saying immediately treat if it happens.
In this one, they're evaluating, so it's already, they're trying to see, it has happened, they're trying to see what was the source. Yes, okay, good deal. All right, good. Let's just look at two questions on this case study, and then we'll move on to the next chapter. Let me see, can I make it all on one screen? Hold on, you all. Moving down the page. Let's see here. Let me just... Okay. Space. Take this off of here. All right. Let's just look at these two questions and then we'll move on. Share this. Okay. Let me see. Okay. Okay, what are we thinking for the first question?
We didn't hear anything you were saying. If you said anything for the last like 5 minutes, we didn't hear nothing.
Are you all able to see the screen?
We saw the screen, we couldn't hear anything. We didn't know what we were doing.
Okay, so we're reading the case study. Can you see the case study? Okay, can't see the case study. So just read through the case study and the 2 questions that are here, and we'll discuss what we think the answer is. Okay, so what are we thinking for, it says number 5. What do you think the answer choice is?
D. A.
We hear a D and an A. So give us your why. Why are you saying it's D and why are you saying it's A?
It's D.
I say it's D because ethnic groups are less likely to do routine doctor visits for either cultural or personal beliefs.
Okay, thank you for sharing.
Yeah, they don't usually discourage children from going to school because they don't have immunizations. Like
I didn't read the full question.
Dang, Ryan.
What was that? I'm sorry, didn't understand.
I said I didn't read the full question.
Oh, so you're changing your answer. Okay.
Okay. I think it's D because a lot of ethnic groups have difficulty with understanding understanding what the doctors or nurses or anything are. They don't have a complete understanding of what's going on, so they don't go to the doctors. They don't take their children to the doctors for their immunizations because they aren't aware of what's going on. They have communication issues.
And so you can be the what for that patient?
They need an interpreter a lot of times.
And when you do that, when you coordinate that resource, you're doing what for that patient? Begin with the A.
Advocating.
Advocating, yes.
Yeah, good. All right.
We have a lot of those at my work. We have to use interpreter services.
Yes. And they're available for the most part, all the settings. Now they may not be full time, but if you need one, they have a resource out there that can, they can connect you with, and they can get them to your place.
We use tablets and phone services as well.
Okay. So I know the hospitals, they have a resource where they can get, people to come in. Okay, and then that second question, a local school nurse calls the public health department to report this. Several students may have symptoms of pertussis. What symptoms does Mr. Brady expect to hear about?
G.
Do we agree with Jada, Miss Jada?
Yes.
Is known having that distinctive sound. Okay, all right, so we're gonna stop sharing. We'll give you just a 3-minute break to stand up and move around, get you something to drink, and we'll be back in 3 minutes.
Dr. Ford.
Yes.
The PowerPoints for this week in the announcement are not loading. It says all week they've been saying they're failed to load.
Okay. So at the end, we're gonna give time to complete the attestation, and then I'll look at those too. So I added extra time at the end.
Okay, thanks.
Thank you for letting me know that the PowerPoints. Just 1 more minute, we'll reconvene here. I know one person, they said they can't ever see them or something, and I know they've communicated that. And we've just sent them to the email, but we'll look at them toward the end because they want us to start letting you all, give you time to complete that attestation, because you all are coming to class, but you know, if you don't complete that, whoever checks roll, they go by roll on that. So we're gonna, allow time at the end for that. So I'll look at those PowerPoints too. We'll get that looked at tonight as well. Okay, and so we're gonna share this Jamboard here. I'm gonna just do a little lecture real quick. Let's talk about some important points, and then I want to hear your thoughts on a topic. So we're gonna toggle over to chapter 5. I want to share my screen here in just a minute. Economics of U.S. healthcare delivery. So when we talk about economics, what comes to mind when you hear that word?
Financial status.
Financial status, economics. Someone else. What do you think about? What comes to mind? Anyone else? So yes, we're talking about the spending, the reimbursements, the insurances, no insurance.
Will be also the budget, like that each family has.
The budgets, exactly. And so it depends on like which department you working in. If you are, for example, the charge nurse, if you're the director of nursing, you will look at things like that more in depth. And so you might be the person that have to plan the budget, to order the supplies. And, you know, if you're like that home health nurse and you know that your patient has this insurance, and it allows for these types of supplies, and you know that they're wanting you to do the dressing change, and I'm just, you know, just making up something here. The dressing change is supposed to be for 3 weeks, but their health insurance covers so many 4x4s and so many drain sponges and so forth. And so you have to take in and think about all of that when you're trying to provide that best care for the patient. And we think, like, why can't we just have all what we need? The United States actually spends more on healthcare, but then we still have our outcomes is not as good as other countries. So, but the economic part, the fact that budgeting, decide that reimbursement, and it's not documented, when those people come in, those coders, when they come in and go through those charts and abstract the information that you all have documented, that the healthcare provider has documented or they didn't document, then they can't submit paperwork or those forms so that the healthcare provider can be reimbursed. Nothing else other than what's being documented. And so who absorbs those costs? Do the healthcare provider push them on to the patient, or do they absorb those costs themselves? You know, having health insurance, the Affordable Care Act has put into play, and you know, it's you know, been debated whether or not it has or hasn't, but its findings have shown that it's allowed for more people to have the opportunity to subscribe to healthcare to insurances. They're all different kinds of that marketplace. There's all different kind out there, and different plans cover this and different plans cover that. Any questions or concerns about the economic growth? Like I said, if you're on that planning committee, that budgeting committee, it's a big to-do. They want to know where every 4x4 went. And you know, if they bought 1,000 and only 800 was charged out, where'd the rest of them go? And who's gonna pay for them? And so if you're in a for-profit organization or even a non-for-profit, you know, non-for-profit, if you don't get those funds to support buying more materials, then how can you provide your service? If you're working for a for-profit company, and those reimbursements, if things are not documented and the coders come in and they can't code and submit for those supplies and things that were used, who pays for that? The cost of healthcare has been rising more than the rate of inflation. We've been hitting inflation here over the last year a lot. So here it is, to make mention of the Affordable Care Act. And they've been doing some repealing, trying to get things changed with that. But economics is a science concerned with the use of resources, including the production, the distribution, and the consumption of those goods and services. You know, if you're the person that's over supplies, who do you order from? Who has the better quality of supplies? Who has the better quality of supplies for the quantity? It goes all the way down. You have to think about all of that. Health economics is concerned with how scarce resources affect the healthcare industry. Economics provides the same means to evaluate the attaining of society wants and needs in relation to limited resources. I think I'm not sure where, but I've heard in some countries, healthcare is free. You all correct me if I'm wrong, but I think I've heard that. I'm not sure where is it at, but I know it's not in the United States, because you can have insurance and you still end up with a whopper of a bill. So healthcare rationing. So you have to decide, what are you gonna do with the resources that you have? Who's gonna get the resources? You don't want to not treat people because they can't pay for it if they're underinsured or no insurance. But depends on what settings you're in. Like I know a lot of the urgent care centers, you can't go past the desk if you don't pay that copay or that upfront payment. They won't let you go past the desk. But like in an ER setting, you can. You just, say that you're gonna pay, or not really say that you're gonna pay, but you're really saying with good faith that you're gonna pay, and then they go on and treat you. But a lot of urgent care centers, you can't, without making a payment, they won't provide those services for you. Medicaid is intended to improve the access of healthcare for the people that don't have many finances. People can't have Medicare and Medicaid. The only thing with Medicaid that we're finding out now is if the states did not approve or accept the awardance of the funds from the federal government, then less people in that state have coverage. So in the states where they did accept the funds, then they were able to expand the coverage for people. So if economics is the area that you want to focus on with your nursing career, think about making those policies that influence, providing more coverage for more people. And that means lowering the number of, persons per household, per income. It has to be some kind of way that we can get to a level as level as you can playing field with that. And then, for the ones that, we always have like a gray area. So people that falls in the gray area, what can we do to help those? Create a policy or something. Most healthcare facilities have those indigent funds. It's not advertised, but they have those funds that they can, throughout the day, either is a daily budget or weekly, where they can provide so many services, free of charge, and it falls under that section, the indigent fund for that week or that day. And again, here we are looking at primary prevention. Can't get away from those levels of prevention. Sure. Over everything there. Refer to my notes. Sure, we talk about everything. The access to healthcare, we can't get away from that either. If the services are available, but then I can't get to the service, what good does it, do for me? So having access is just a huge, factor, and it's real. So we must plan for future changes in healthcare financing by becoming aware of costs of nursing services. Why aren't we, what's happening to our supply? I do know some healthcare facilities, as far as your blood pressure cuffs and things like that, you, the nurse, are responsible for bringing your own. How do you all feel about that? If you're working for a facility, not that you're in clinical, but you're actually working for a facility and they're wanting you to bring your own thermometer, your own blood pressure cuff. Do you all agree with that?
Nope.
No.
Yeah, and so this is how different industries and businesses are offsetting their costs. So they're passing it on to the employee. I mean, it is, so when you decide to go work, wherever, you might want to ask about things like that, supplies that we need to take care of our patients. Are we responsible for them? And I've heard of, not many, but I was surprised. I was like, wow, like blood pressure cuffs and thermometers, really? But yes, that was so. And so we do know that as time has evolved, with our understanding of infectious diseases and being clean and sanitized, things have changed. in the pre-industrial area, you know, people ran from the hospitals. They didn't want to go to the hospitals because if you went to the hospital, you were sure not to come out alive. Did you all read through that in this chapter? And so it was because of, remember, Florence Nightingale and all of them, when they start looking at the living quarters, they were crowded, they were unsanitized. And so doctors were making, back in that time, house calls with their black bags. And they still make house calls now. They don't really advertise it, but they still do. So as environmental conditions begin to improve with major advances like water purity, you know, sewage disposal systems and all of that, hospitals and health departments begin to experience growth. Because, you know, once they understood and, you know, the things to do, then they were able to implement those things. And people began to come to the hospitals. People used back in the day, you know, you all probably don't remember this. You go to the hospital for something, you stay in a hospital for like 2 and 3 weeks for something now that you would stay in there for like a day and a half for is totally different. The economics and some of it is part because we have improved in our, you know, we've been innovative and we have a different, better understanding of how to take care of people and to facilitate the healing process. You know, advances in technology and knowledge has shifted education away from apprenticeship to that science based. You know, is it evidence based? Is what we're doing, where's the evidence? What's the why behind it? If it's not evidence based, they are pretty much, you know, not going with it. Those are the only points I pretty much have for chapter 5. Just looking to make sure. Any questions about chapter 5? Okay, so I'm gonna look at the Jamboard. So for the most part, Medicare take care of those that are 65 and older and disabled. And then Medicare, if the person, you know, have a issue or challenge with finances, then, but people can have both. Talked about the Affordable Care Act. And those, I kind of mentioned the managed care, like I said, things have changed. And so some of your patients' insurance companies, they can only see people in network. And if they decide to see someone out of network, then they absorb all of those costs. Okay. Let me pull up the Jamboard and let's have a discussion. And I'll put the link to in the chat if you're not able to click the link and copy the link. And so I'm going to place the link in the chat. So click the link, go to the little square on the left side and respond. And if you can't do the Jamboard, put your response in the chat box. So you're responding to, society has an obligation to provide healthcare services for people who are poor, uninsured, and underinsured. How does the economic status of these groups affect their access to care and receipt of healthcare services? Let me hear from you. What's your response? Give you a few minutes to read through that and respond. If you have not placed your name and your campus in the chat box, make sure you do that before we end. So understanding how does a person's economic status, you know, that might affect the services they provide will lead you in the direction of like what resources do you need to be thinking of? What resources should you be trying to link and provide? Or what resources should you be giving your patient information about? So once you click the link, click the little square here, and you just type your response and click save. And are you all having problems clicking the link and getting to this Jamboard? Now it's part of Gmail, so it's supposed to be safe. Sure, it's like somebody's, let me stop sharing. Make my little thing small. Looks like someone has pasted something new, but. Stop sharing. Several of you have responded in the chat, but let me just click back over here to the Jamboard to see. Okay, now they're getting on the Jamboard. I'll give you a few more minutes, 2 or 3 more minutes. So you can respond in the chat if you like, or the Jamboard. I'm gonna share. We'll start with the Jamboard and then we'll come back to the chat box. Sometimes they'll go on top of each other, so I'm just trying to make sure no one's sticky note is not back there. Okay, can you all see the Jamboard? So far, we just have one person that's responded there. Certain communities will be discriminated since they are not able to elaborate the necessities due to language barriers. Okay, care to add anything else or explain or give voice to what you wrote there? I'm not sure who wrote it. Justine, is that you talking? Who places sticky note up on the Jamboard?
I did.
Okay. So
basically, I've met people like elderly that they're not English speakers. So there is programs like Medicare, you know, they have the OTC, they don't use it. Like sometimes they don't know they have that advantage to use that.
So that's a resource that you would make sure that they know that's available.
Mm-hmm.
Okay. All right. So yes. So kind of like thinking ahead, you know, just kind of thinking through, because that's real, you know, but they need the healthcare, but how are we going to get the healthcare services for that person? This affects them because they deal with different disparities, whether it's language barrier, transportation, or financial difficulties. Who wrote that one? Give voice to what you get some explanation.
It's mostly because when it comes to like even in like we was discussing in like rural areas or even just in the main city areas, they all have different disparities, whether it's financial or they're single parent or they just not making enough crops to get money. They don't have the knowledge to know that, okay, I need to go get checked every year. I need to go to the doctor and see what he can do to help me with this issue. They don't even know that resources are available to them, especially the rural ones. But in the city, a lot of times it's also just now not having the knowledge to know to ask, or not knowing the lingo to ask the proper questions to get the answers they need.
Great, thank you both for sharing. Let me go to the chat box, 'cause I don't see any other sticky notes of it. Let me stop sharing and go to the chat. Good. Okay, let's see. Okay, Ms. Lakeisha, give voice to what you've placed in the chat.
So if they're already eligible for Medicaid or Medicare services, really Medicaid, because that's the one that's income based, and they're uninsured or underinsured, they're more than likely going to have other resource disparities like transportation, consistent, proper living conditions and things like that. So that would affect them wanting to go. I also put in there that their pride, because when you don't have what other people have, even if a service is offered for free, you feel that shame, like you feel bad for yourself for wanting or needing to go get and utilize that free service. So a lot of times there's that apprehension too.
Great, thank you for sharing. So not only those resources to get those, to get the healthcare you need, but also having that conversation, establishing that rapport, and building up that self-esteem. Great point. Justine, I see you're next. And we'll just hear from Justine and whoever else wants to give voice to what they placed, and we'll move on.
So I just think it's not really fair that people that are lower income don't have access to the same healthcare that people with like private insurance does. There's some places that don't even take Medicaid or Medicare. And they may be somewhere that's able to provide the best care, and that person doesn't have that option to go there. And I just think healthcare should be universal.
Thank you for sharing. And I think it is a place, do you all know, is it England? It's somewhere that you just go get your health care, and everything is all paid for. You get what you need.
Canada.
Okay, thank you. I knew it was somewhere. I didn't know where, but yes.
And I think England too.
Okay. Great. One other person you want to give voice, because you have to think about all these things, that holistic care. So yeah, this person has diabetes, but you have to think about all these other things that, the self-esteem, are they ashamed of, whatever their challenges are? Can they even understand the instructions that are being given? Do they know how to coordinate the public transportation? You have to think about all those things.
Well, we also have our homeless population that they don't know how to assess a regular doctor's office. So they use our ER as their doctor's office. And that is a huge expense because they don't know any other way of getting to a doctor or don't have access to another doctor.
Yes, that is a great point. They, it depends on if the person has more month than supplies. So for those of you that will be, ER is going to be your way, you will see that if people have more month than supplies, whether it's insulin or colostomy bags, you'll see the trend starting whatever day of the month. You'll start seeing those patients come to the ER, because a lot of times they don't know that those other resources are out there. You can't, for the most part, you can't go to those urgent cares because you cannot pass go without those funds. Now there are, I know in the areas around, they have they call a doc on a bus where they go and It's like a mobile clinic and they provide, free healthcare. They have, is another clinic where it's all based on volunteers. So the doctors volunteer, the nurses volunteer, and they run as a clinic, but the services are free. So identifying those other resources, that are more, I want to say, the acuity, like you were saying, the ER's resources, if you go there, the acuity really isn't, critical, but, they have to stop and take care of the patient. And so, if the people know that, hey, this resource is available on the same side of town, right down the street, and it's just, not knowing sometimes. Because it was a while before I even realized some of those resources were out there. Okay, so now we're gonna move on here. Let's see here. I want to look at one level of prevention, and I want you all to tell me what you think. Let's look at C. Which level of prevention? This is where I'm let you read through it for C.
Primary.
We said someone said primary.
Mm-hmm.
Let's see, I think someone put something in the chat box. Let's see what you put in the chat. Okay, I see primary in the chat. Let's go back to it. So the way it's worded is kind of a loaded. If this would have said, participate in home visits to mothers who are at risk for neglecting to reduce the cost all the way to the end. And then the other part of it would have said, participate in home visits to mothers who are abusing babies. Would that still be fine? Yeah, I got it. Yeah. Got it. Good.
This is primary.
Yes, but essentially it's primary because it hadn't happened, but that or abusing babies, it's not clearly defined that it appears that they're at risk for abusing.
Yeah, the at-risk makes it primary. If at-risk wasn't there and they had a diagnosis of postpartum depression or something like that, then treasure.
Yeah, who are yes, and that's already happening. Okay, let's just look at two of these questions here from this case study, and then we'll move on. Let me see, kind of move us over out of the way. Have we had time to read through yet? Okay, so what are we thinking for question number one? What primary prevention measures? What are we thinking? Let me see, someone's putting it in the chat.
Yeah, we put it in chat. Yeah.
Let's see. So we're saying A, let me go back to it. So work with the insurance company to provide coverage for the medication as it will reduce the length of the illness and future costs of care. So what's your reason, why are you all saying that's the answer? What's your explanation?
Because if you get the medication covered for this patient, then he'll be compliant, more than likely compliant, because he won't have that stressor of where am I going to find the means or how am I going to get this medication. So in the end, he won't have any complications due to non-compliance, and that brings all the costs down because he won't need to seek care for anything else that's related to this condition if the medication is as effective as it should be.
Okay, thank you for sharing. Do we agree or disagree? And if we agree or disagree, tell us why. One more person. Jada, you put A, so you agree. So tell me why you agree.
I agree because, like Ryan said, it's like a prior auth. This is something that we typically do anyway for our patients to ensure that they get the proper care that they need. So we order them an inhaler because they've already failed the pill treatment and they failed the rescue inhaler treatment. So we're giving them a steroid. Their insurance doesn't cover this steroid, but this is the only other option. But the insurance don't cover the steroid because we didn't have the proper documentation in place. So we have to call them and give them the explanation on why they need this certain med to prevent them having future illnesses and hospitalizations. So hence why it's a primary prevention to prevent them from getting worse.
Thank you. Ryan, you did say get that PA for them. Thank you. And question number 2, which of the following payers are most likely to cover preventative services for clients? Medicaid. Let's see what else people are saying. Medicaid. Here. Trying to find it for you in that chapter here. Okay, to the top. Here. And so what's the whole purpose of getting those preventative services? Is making those preventative services available.
Preventing and monitoring what could potentially be chronic diseases.
Exactly. And the chronic diseases, there will be, if you can prevent it, then there won't be any, other costs in managing those chronic illnesses. I was just trying to make sure that it wasn't. Yes, so that's the whole purpose of it, just preventing it altogether. And so now they are the third-party insurances are big in buying in with that now. And so they actually charge you a fee if you don't get those screenings and what they call those preventative services done, so that they can go ahead and so they can get ahead of things. And it's been, I want to say someone actually got a lawsuit or something about it. It was like, okay, I subscribe to your insurance, but then you're going to tell me that I need to go and still do these things. And the insurance company was saying, well, hey, this is what you're signing up for. Yeah, we're going to provide coverage, for the different services that you're going to get. But our policy also says that we want you to also get these preventative services to participate with the preventative service. For example, I know if they had, if one of your wellness checks showed that your cholesterol or something was up, then they wanted you to call in and talk to the nurse, and they will go over your diet, over the vitamins and things that they had recommended to see if you were actually, if you had made those lifestyle changes and modifications. And as a result of it, you had an extra fee added onto your insurance every month. They gave you a certain time. Okay, yes. Someone shared too that you get patients for annual visits just because the insurance gives them the $25 gift card. Exact, because if you don't, the person I think is charged $50. I know our fee was $50. If you didn't do those things, you got charged $50. But like he said, they gave you $25 for going ahead. Yes, those third party.
Yeah, they want all your blood work done, your mammogram, your colonoscopy done, all those things.
Exactly. It's something. So we're looking for you all to be those change makers, to create those new policies and procedures, to revise all this stuff. It's just like, wow, what are we doing here? So, but anywho, our time is about to run out. I did not cover chapter 27. I posted the recordings for 12 and 13, went over 5 and 11. So 27 is what I have left to review. I'll record that and post it. The review session is on Monday. Please attend one or either at least watch the recording. And okay, they got a point system going too. Yeah, someone's trying to think outside the box with that, just trying to get people to be, I guess, make healthier choices, but some of it is kind of punitive, So at this time right here, we're going to take a pause, complete your attestation, and I'm going to look at those PowerPoints. Be looking for the, if you don't attend the recording, the review session on Monday, please look at the recording. Please look at the recording. And for those of you that would like to meet for a few minutes or whatever to review something, your old exam, some points for the new exam beyond the review, call more than one time. If I don't pick up, call back. And we can kind of schedule a time if we need to. But this is your last exam. You are free to go, but don't forget, you need to complete that attestation, and that is how they check roll. We have said you all are here in class, but if that's not documented, that means you were not in class.
This is week 7, right?
Yes.
Okay.
And I'm going to look at those PowerPoints and let me know if they're still not showing. I'm going to go over here now to look at them. And I might have to just send them all out to your email. I'm not sure what's some of those little, I don't know what goes on with this electronic stuff sometimes. Let me look at them right now.
Professor Ford, for the one that we have to do the peer review, can it be handwritten or it has to be typed?
So you just, that form is fillable. Did you download the form? It lets you type, you can type on that form and just save it and then submit the form. Just download it, like however many people that you have to evaluate. If it's 3 in your group, so download it twice. You just name it, different names, A or B or whatever, and fill the form out and just turn and save it and then turn that form in.
Oh.
Yes. But yeah, it's fillable.
Oh, so there's a form that we have to fill out?
Yes, the peer review form, you're grading or rating your team members.
It's in the, she sent it in the announcement. If you just click on the announcement.
Our team members.
Yeah, you gotta evaluate the people that was in your group.
Oh. Hey. That's.
And it's anonymous, you know, it's not, I'm gonna be the only person that's gonna see it. Team members are not gonna see it.
Okay.
And so.
All right. Okay.
Okay, so I'm on those PowerPoints. Let me see what we can do here.
When is that due, the peer review?
It's due today, right? Today, the 29th.
No, it's due Sunday. The peer review is due Sunday.
Sunday.
At our normal time for us to turn in the rest of our stuff. Sunday by 11:59.
Yes, thank you. The 29th, yes.
All right, thanks. Have a good night.
All right, you too. Okay, here's this PowerPoint. Let me see what's on. And okay. Lakeisha, are you still here? So for those of you that are still on, are you all having problem looking at the PowerPoints too? Are they not downloading for you?
Yeah, it's not downloading for me either.
Okay, so let me just send it, let me just create a, so if you would just hold on, let me do a test. I'm going to create a mailing. I'm just gonna mail it to all of you all, and I'm gonna attach it that way. Let's see, and you just let me know if you get this. Let me see. Let's see, PowerPoint, so I'm gonna name it PowerPoint. Week 7. Okay, let me attach 5. Okay, 11. Let's see here. Can I minimize this? Okay. I didn't download all of them. Hold on 1 second. I need to download the other 2.